hope you all had a great lunch. Thank you for spending an hour with me this afternoon and learning a little bit about our Resident Health Services Department and what we do. If you've been at Westminster for a while, you've probably seen this very similar presentation. We try to do it once a year. Same as like our healthcare center does a presentation once a year, assisted living. But Resident Health Services is a department that I run. I'm Traci Lindesmith. I'm the Director of Health and Wellness. And Resident Health Services are the health services, the wellness services that we provide for you folks who are in independent living. So my services, my department, we don't cover assisted or memory support or healthcare, just to start off with that. Okay? Let's see. All right, so just a little bit about me, and hold your hand if you can't hear me or you need me to repeat something. Again, Traci Lindesmith. I am by trade, a registered respiratory therapist and a pulmonary function technologist. I started off my career many, many years ago going to respiratory therapy school back in Akron, Ohio. That's where I'm from, and did many years, about 15 years of my career in hospital bedside, working with respiratory patients, ICU patients. I lived in Dallas for 13 years, and so when I was there, I worked at Children's Medical Center. So I have a great deal of pediatric background in hospital work. But when my family and I decided to move to Austin and raise our children here, I kind of went the more geriatric senior care route. So I have been, I've worked in home health, I've worked in private duty care, I've been an executive director for hospice. So really kind of senior based, but always kind of homebound, housebound type of care. So going back to the home health and private care, 6 years of that experience was here at Westminster. Because back in 2010, we did our own in-house private caregivers and home health, and I ran that for 6 years, and then they decided to kind of outsource that. And when I left here, I went to a company called Visiting Physicians Association. So again, taking care of seniors in their home, we would send the physicians out to do health, kind of like what Dr. Pellegrini does here. So I did that for several years in the Austin office, and then I kind of went national and did it kind of regionally for a while. So I've done a little bit of everything, I feel like. Let's see, let me move on. Oh, this crazy picture is just my life. Talking a little bit about my life, I have two wonderful boys. Of course they're wonderful, they're mine, right? Clark and Carson, they're both they're just kind of fresh out of college. One's 22, or about to be 23, the other one's 24, so. They are wonderful. We live really close to Lake Austin. I raised them on the water, you know, on boats and that kind of thing. They're both great water skiers, and we have a lot of fun. That's Ruby in the middle, because when Clark came home from Texas Tech, he brought home a dog. So now we have a dog. In my spare time, I am, I'm about 3 months into learning how to be a potter, like pottery school. I'm taking classes for that and loving every bit of it. I love to cook and bake. I'm really into sourdough bread, and let's see, what's that little circle at the bottom? I have a great group of girlfriends. That's how I spend my, time off, is spending time with the people I love and making pots, sometimes good ones and sometimes not so good ones. So that is me. So my role here as the Director of Health and Wellness, kind of has a lot of buckets to it, right? Definitely, I would call myself the practice manager of the wellness clinic. We'll talk a little bit about, the clinic if you haven't been there, but what we do and who works down there. And I'm also the health and wellness navigator, and that is as a big part of what I do is helping y'all navigate when you need assistance going in and out of different levels of care, or in and out of the hospital. Or say you went out EMS and needed to come back. I'm just the person that you would come to help you wiggle your way through all of that, because it can be complicated. Who do I call? What do I need? How do I get connected to services like home health after I come back and all of that? So I'm that person. Definitely work with residents and families and associates to, present different programming and presentations. Our clinic does presentations, myself, we do a lot of just educating with you guys. I work really closely with the wellness committee. I'm on that committee, so they're constantly bringing you presentations and health-related content at those 7 p.m. Harris Bell Hall things, and hopefully you're enjoying all of that. We're always open to new ideas and helping us find new things for that. We talked about I'm the clinic director. Wellness checks, I coordinate that program. I'll talk about that a little bit more in a minute. The Independent Living Database, or EMR. Actually, I'm not going to take credit for that. Diane, my administrative assistant, spends her whole life with her face in the EMR, making sure we get all of your information into not only that system, but also our clinic billing system, and make sure that it's always accurate. And if things change, she's the person that we, give that information to, so she can make sure it's just always accurate. So if you have something like a change in your insurance or your insurance card, or you now have a DNR and you didn't before, make sure we get a copy or a notice that things have changed. It's really important that, when, God forbid, EMS shows up, when we grab your vital life, it's accurate. It has your most updated medical information in it, your med list in it, blah, 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 blah. So, and then I also do health assessments on new residents that are thinking about moving in. So we do assessments on everybody when they go to a different level of care. If you guys were thinking about moving over to assisted living, that director would do an assessment first. When you're thinking about moving to Westminster Independent Living, you probably, I'm sure you all had an assessment. We want to make sure that this is appropriate, that you're going to, be able to navigate Westminster. It's a big campus, right? We want to make sure that you're going to be able to, enjoy everything we have to offer. So, what else do? I'm in meetings a lot. You'll probably know that, but I do meet with all of our vendors. I meet with Select Rehab on a regular basis, with Halcyon on a regular basis, Care for, just making sure that I kind of know what's going on with everybody, if you're using a lot more caregivers, or I just kind of keep track of all of that activity. We coordinate vaccine clinics, and you're going to hear a lot more about that here in the next few months, because before you know it, it's going to be fall, and it's going to be time for flu shots again and COVID shots again. So the girls, the nurse practitioners in the clinic, do 2 presentations a year. One, just kind of like this one, to let you know what services they provide. They just did that, I think, late May. And then we'll also do one probably late August or early September, just to talk all about flu and COVID and vaccines and all of that, just in preparation of those clinics that are going to be coming up probably the last week of September, 1st of October is when we usually do it. Podiatry clinic is under our kind of department. I spend some time with that. Diane spends a lot of time with that, coordinating appointments, making sure those, orders are written, and da-da-da. We usually have a podiatry clinic at least once a month, sometimes more than once a month. We do them in the beauty salon, thank you, on Mondays when many of those guys are closed. So if you need more information, let us know about that. And we also have other outside health services that come in, and we coordinate with them. So, we have an audiologist that comes in, we have mental health, we have a dentist that comes in, we have massage therapists, so just coordinating a lot of health and wellness things for you guys. And then I'm definitely, your advocate for residents who just might be struggling and need to sit down and talk about, I just haven't been feeling good, or I'm just, worried about my neighbor who isn't been getting out of the apartment, they're isolating, and, just, let me know. Maybe we've got something we can put in place that will help. That's what I'm here for, is to advocate for you guys. Let's see. So health and wellness is a whole different bucket. I just recently got certified as a wellness I guess, a certified wellness instructor. But the goal for health and wellness is to, do our best to provide things that are going to connect you guys, not just health-wise and making sure you're not sick, but making sure you're also kind of living your best life. Are you participating in things that are connecting you socially, physically, with all of the programs we do down in the gym and everything? But we're providing things, Ruth and I and Rachel, that support you, grief support groups and spiritual things like the chapel and just all kinds of things, just not just the clinic and when you think of health, illness related, but also wellness related. Let's see. Real quickly, hospitalizations. I would love it if you all would let me know when you're having even the smallest little procedure, because it can turn into a little bit more, and I like to know when you're out going to the hospital for something. And I'll, if it's going to be a big procedure, I definitely connect with the case managers, the discharge planners. Maybe it took a little bit more out of you than you thought it was going to. And so instead of coming back to IL, if you're coming back to IL, maybe you're going to need a little therapy to get stronger, back on your feet. I can connect you with that. Maybe you're going to need some aids to check on you a couple times a day. I can connect you with that. But maybe, you were in a few days longer and you're a lot weaker and we need to go to healthcare center for a little rehab before you come back to your IL apartment. And I'm that person who will work with them, work with the admissions team over in the healthcare center to make sure that works really smoothly. They're going to need to get records over there and, information. Let's see. This is what I was kind of talking about, the health and wellness and the 8 dimensions of wellness. I'm super excited about this. Right now, we offer, some really great options so that we're, connecting you with all of these different dimensions of wellness. So your mind, body, spirit, they all come together, unlock your, best life. We're going to be doing a lot more work around this and rolling out kind of a health and wellness on steroids program later in the year. The thought is we want to make sure we're really providing as much as we can for you guys, and maybe work on doing some really personalized programming and getting you guys tapped into things. And if you have ideas for things we're not offering that you think would be lovely to have, please come talk to me. All right, so teamwork, it takes a village, right, to do all of the things that we do. Diane, my wonderful administrative assistant, is also / notary. So she is busy with all things EMR, advanced directives. People change their minds on things like DNRs and physician's directive and have to have new forms put in place. And so she is just an expert. You can make an appointment. She'll sit down with you. She knows right where you have to sign and right where she has to notarize it, and right where she'll send it out to the doctor afterwards, track it until it comes back with the physician and make sure it gets in your file of life where it needs to be. She is the person who will send out that packet once a year. So when you first move in, marketing gets all of that, paperwork from you. They get your medication list and all of that information, and we do that file of life. It's probably in there before you even move in, and your refrigerator, it looks like a gigantic pill bottle. What's inside there, we're going to go into it in a second, but what's inside of there needs to be as accurate as possible. So once a year, I wish we could do it more often, but believe me, it kills her just to do it once a year for everybody in independent living. We're just going to ask you to look through the documents we give you and just let us know if there's been any updates. So, what's changed. A lot of times your physician has changed, or your pharmacy has changed, or your medication list has changed. So we appreciate you filling that out. What else? Diane is very involved in the podiatry clinic. She sits in there, and if you don't show up for your appointment, she's going to come get you. Make sure you come down. Rachel Gill, I'm sure y'all know Rachel. She is my partner in crime. Definitely, there's a lot of, so she's a social worker, everybody knows Rachel, and she really helps me with, you know, all of the grief and support groups, and she does a lot of fantastic presentations and support groups. Let's see, she also helps me with new resident orientations, new resident health assessments when they come in. Angie, I'm sure you've all met Angie. She is our fitness coordinator down in the fitness in the gym. She can do one-on-one instructions with you. She can do fitness tests on you. She does a lot of the exercise classes. And there's the wellness committee. These are a fabulous group of ladies with a lot of knowledge. Most of them, you know, been in healthcare. I think all of them in some form of healthcare, you know, in the past, and so they work really, really hard. I think we are booked out like a year out with presentations that we're going to be bringing to you, but always open to new exciting things. So these are just, you know, other departments at Westminster that I definitely couldn't do without. Every morning, you know, I get a security report from every single building with any concerns that they have seen. Every morning, I get an incident report on any time a nurse or a wellness, you know, aide has had to respond to something. So I feel like I'm pretty in the know, but I also, I mean, the staff here is wonderful and they care so much about you guys. I get emails from someone in the dining room, I'm just a little concerned, so-and-so seemed a little off last night or they weren't feeling, you know. It definitely takes a village, and I get a lot of, you know, just drop-bys by you guys. You know, I saw my neighbor, I haven't seen him, you might want to go check on him. I love that. Please do that. I can't, you know, keep my eyes on 475 people all at once. So yeah, just let me know if you see anything out there, behaviors that are concerning, if you see someone who, you know, normally isn't confused, but today they just didn't see themselves. If you see a fall, people sometimes hide that they have fallen. They don't want me to know that they have fallen, but I like to know when anything's going on that is out of the norm. Let's see. This is a picture of all the girls in the wellness clinic. Fabulous. We have 3 nurse practitioners. Kathy and Ann have been in this clinic for years and years. They're fabulous. Lisa Bouillon is our newest nurse practitioner. When did she start? December 1st, I think. Y'all don't see her as much because we keep her over in the healthcare center, and she does all the resident visits in assisted living, memory, first care, first floor and second floor in the healthcare center. So she's a busy, busy girl. They all are supervised by Dr. Pellegrini. Nurse practitioners have to have a supervising position. And so it's a tight group. We all kind of, you know, keep each other in the loop and know what's going on. The clinic is open Monday through Friday, 8:30 to 5. They're on the first floor of the Windsor. I hope y'all know where they're at. If not, please find them. They're right on that Windex. When you come, just show up. Hopefully, I mean, call and get an appointment would be the best because they are, you know, appointment based. But you know, if you need to pop in and just see if somebody can take your blood pressure, do that. Just have a seat, and we'll get you taken care of as soon as we can. Let's see. The clinic, you know, they can take care of acute problems if you're sick. Oh my gosh, I can't breathe. I'm full of gunk or whatever. Or you think you've got a UTI. They can do all kinds of lab work. They can run the urines. They can draw blood. If your doctor wants you to have a blood draw, you don't have to go out. You can come in and we can do it for you and send the results. They can do an EKG. They can take care of skin tears, wound care, things like that. If you need a referral in order for therapy because you're feeling like your balance is off and you want some outpatient, they can write those orders. And like I said, come on in and jump on the scale anytime you want to, or we can take your blood pressure if you're concerned about that anytime you need to. Let's see. Okay, let's talk a little bit about emergency calls. I hope everybody knows, but I'm going to say it over and over and over. Make sure you know where your pull cords are in your apartments. And I would love it if everybody always wore their pendants. We want to get you help as fast as we possibly can, right? Your pendant has a GPS function to it. So if you're in the bistro and you fall and you hit your pendant, we'll be able to find where you're at. What happens when you pull the cord or hit the pendant, first is security will respond. It will run right up there. Hopefully you've bumped it or knocked it or pulled it by accident and we can clear it. Those are my favorite kind of emergency calls. But if security gets there and it looks like you have a medical issue going on, they're going to radio right away for a nurse. One of the nurses, as well as the wellness aide, will come, and she comes over from the healthcare center. And hopefully they can take care of what's going on. Maybe you've fallen, and if you have fallen, you have to wait for a nurse to clear you. And I know that is a pain, right? Help, I just don't have the strength to get up, just lift me up. We have to have a nurse. Just make sure that there's no chance that you've had a fracture. There have been cases where everybody thought it was when they stood up and then just the weight on that hip has turned a little crack into a fracture, and that's not what we want. We want to make sure you're okay. But if you've fallen, especially maybe you hit your head and you're on blood thinners and if something really, or you're bleeding and need stitches or something like that, they're going to call EMS. All right, and that's why it's really important that your Vial of Life is always in the fridge and it always has the most updated information in it, right? So if EMS shows up, it's up to you whether you go out with them or not, right? They're going to tell you what they recommend, what they think in their professional opinion, but it's up to you whether you go out with them. Some people, my daughter lives across the street, she's going to come, she's going to drive me, that's up to you. This is independent living, and this is, your choice how you manage that kind of thing, but you will probably, if there is an incident, get a call from me or from the clinic the next day, just to make sure you don't want to come down and visit us. We'll make sure you're not sore after that fall that you had yesterday, or you were called the nurse because you were throwing up last night. How do you feel this morning? Do you want to visit? So we're going to follow up on that kind of thing, not to bug you or get in your business. Let's see. So just so you know, the nurse that responds can't really give you medication or they're not there to be, a doctor visit. They're there to stabilize the situation and provide kind of emergency care at the last minute. Okay. I think I said this already, but if the resident is sent out to EMS or taken by a friend or a family to the hospital, you're probably going to call first, especially if you went out to the hospital. I'll usually call you, find out if they admitted you, and then start working with your discharge planner and figure out what the return to Westminster plan is going to be. Okay, I already said this. Please wear your pendants. If you can call 911 yourself if you're having a crisis. That's, everybody can do that. But what is very, very helpful is if you also, when you're in the middle of that, people, oh my gosh, I'm having chest pain, 911. But if you can pull that cord as well, so that our team knows that there's an emergency going on, for several reasons. Number one, if EMS shows up at the front door and the front staff doesn't know anything's even going on, they don't know where to send them. If we know they're coming, we can greet them at the door, send them straight to the right wing, straight to the right elevator, boom, it just makes it so much smoother. So you can call it yourself, but what the process, what we like to see the process is you pull your cord or hit your pendant, we respond, we will call 911, we will, follow up that way, okay? Falls or major injuries, the same thing. If you fall or have an injury, activate the system. Don't hide the fact that you've fallen. If you don't need help, they're just gonna look and say you're fine, and they're gonna, call us if you need anything else. And I did say about security cannot lift you. They can't lift you even, you know, so I'm sorry, we'll get you a pillow and just wait till the nurse gets there and keep you nice and comfortable. All right, returning back to IL from the hospital. That's what we love to see. You went in, maybe they tested you, everything was good, you're coming back. But we have some things we can offer. Maybe, you know, you've fallen and you need some outpatient therapy. I can help you get that coordinated. Well checks, we have a program here at Westminster, I'm going to talk about it here in a second, but we have an aide 24/7 and she can check on you a couple times during the day for a few weeks. Maybe you went out to the hospital to have shoulder surgery and they're going to discharge you pretty quickly, right, because you're fine, but it is really tough to get dressed in the morning after you've had shoulder surgery for a while, right? So let us come in and help you in the morning for, you know, or if you want us to come in and just, you know, heat up some soup because you had the flu for a few days. You know, our wellness aides are wonderful. They're wonderful. I can't speak. They really do care, and they will help you hopefully, you know, bridge back after you're under the weather. This is just more about if you're going to the hospital back to the healthcare center. I will notify the healthcare center admissions coordinator team, and you know, come up with a plan. If the plan is that you're going to be needing to go back to the healthcare center, we're going to get records from the hospital. They're going to review those records. They're probably going to be able to skill you over there and bill that state to Medicare. There's a lot that goes into it. I do meet with those folks every single morning at 9:30. We talk about everybody who's kind of on the radar, who's in the hospital, who just came out. So we all work really, really closely together. This is, I'm all over the place, it looks like. This is the, again, the vial of life and what goes in there. If you've never opened it up, your face sheet is in there. So the main sheet that has all of your information on it, your name and your doctor's name and your insurance information and whether you're a DNR or not, who your power of attorneys are, who your emergency contacts are. Your medication list is in there, and if you have a DNR, it's in there. So leave them in the fridge, preferably in the door is where we start, but as long as they're in there. Do not remove from refrigerator. All right, advanced directives, touched on that a little bit. Kind of gets confusing for a lot of people because there's, you know, advanced directives is a broad term for several different documents, and people get them confused a lot of times. Particularly, what is a physician's directive versus what is a DNR? I see those two kind of get confused a lot of times. A DNR is a do not resuscitate. That is your wishes, and your doctor has signed it, that if your heart stops beating, we will not try to start it again. We will not start CPR. You can, the DNR is completely up to you whether you have one in place or not. It has to be notarized, your doctor has to sign it, and it is really important that we keep that in your vial of life. It's the first thing EMS is going to look at, right? But then the physician's directive is kind of my directions to my doctor or to the hospital doctors if I can't speak for myself. I don't want to be on a ventilator. I don't want a tube feeding. I don't, you know, very specific, you know, instructions to them if you get to the point where, you know, like again, like you can't advocate for yourself. So, in addition to these advanced directives, physician's directive, DNR, we also, you know, kind of lump your power of attorney paperwork in there. We have medical power of attorney, financial power of attorney, durable power of attorney, all of those documents. And we keep all of that in your record. If you've lost it, we could always, you know, print new copies or things like that. If you've updated any of that, you know, you've taken somebody off and put somebody new on, get us a new copy. We'd love to have that on file. We also keep track of the motorized scooters around this place. There's a lot of them, but we keep track of them. Any resident that has a scooter has to be registered with me. We have a big log sheet, and they have to go through some training with our occupational therapy department. It's really important that they know how to navigate and drive those things safely. They need to know, which elevators are too small and it's not safe to use. They need to, watch the speed limit, those kind of things. So all of them, she puts little tags on them so we know that everybody's safe. And Robin always asks me to put this little note on here. Those rollators are really nice, but please don't put your friend on it, have them sit and wheel them around, because we've had people fall. They're not meant to, support that kind of, way. So please don't use them as wheelchairs, I guess I should say. All right, pets. If you have a pet, they should have a vial of life in your refrigerator too. And in that vial of life, we like to keep track of who their vet is, and most importantly, who do you want us to call if you have to go out? If you live by yourself and you had a fall and you had to go out, who should I call? To take your pet maybe for a few days and take care of them. So we like to have that on file. Just a quick list of we have so many exercise classes, and I have a big list of them, and there's a big monthly calendar, but gosh, we encourage you guys to take them. I hope we offer something for everybody, from just sitting in a chair to pretty robust, different classes. There's aqua classes, there's things, just for men classes, and resident-led classes, so I'd love to see everybody participating in that physical dimension. Let's see. We have a lot of partners. Select Rehab definitely is right across from the wellness clinic. Select Rehab, they offer PT, OT, ST, outpatient. That is billed like any outpatient physical therapy facility you would go to. They would bill that under Part B. So you might have a copay for that, but it's right here, it's on site. You don't have to go out to a clinic to get some therapy if you need it. Home health, we work with several different home healths. Halcyon is our preferred provider for home health right now. We have a liaison right here on site every day who can get you set up with home health. Home health and hospice right now are two services that Medicare still reimburses under Part A, meaning they cover it 100%. And I pray that stays that way. Outpatient, like the wellness clinic is outpatient, rehab is outpatient, those are under Part B billing, and so it's like that 80-20 kind of coverage. Pharmacies, we definitely partner with pharmacies. Our preferred is Terrytown, because they're so close and they deliver like 3 times a day, and they come in and do a lot of our clinics with us. Let's see, and we work with several hospices, case managers. I definitely partner with family members. I sometimes have to really educate family members on, how this whole, different levels of care work, and, people don't realize sometimes that you can't just pop over and, go spend the night over there and come back. So there's a lot of work with them. In your independent living apartment, just so you know, we can provide well checks. You can have personal services providers come into your apartment. It's completely up to you. If you need assistance from a caregiver, you can go through an agency, which is great, or you can hire people on your own. If you go through an agency, so it's about security really, and people that we want on campus, and we try to limit who's on campus, and we want to make sure that if they are here providing services that we have vetted them. So if, for example, you hire a caregiver through Halcyon, they are responsible for sending me a copy of their background check for every caregiver, a background check, a TB test. They have to go through our kind of orientation so that they know our hospitality promises and all of that. But if you hire someone privately, they need to come and see me and fill out a packet and go through all of that as well. so that every single person that's coming in providing any kind of service here at Westminster to our residents have to check in through the AccuShield system, just like your visitors do. And it sends me a report if they haven't had their background check or their TB test or anything like that. So we want to make sure everything's good. Let's see. A little bit more about wellness checks. They're 24/7. We have somebody on every shift. They are certified nursing assistants. We can provide the wellness checks to you for up to 2 weeks. It's a complimentary program that Westminster offers. It's not forever. So like I said, transitioning or bridging back from the hospital or the healthcare center, you're just not quite back to normal and need a little bit more support. We can do up to 3 visits a day. Those girls can check on you, and it's a 30-minute visit. So, sometimes right when you come out of healthcare, we'll put them in 3 times a day, and then we go to 1, they kind of bridge down to the point where they don't need them anymore. Let's see, I can order those for you. One of the clinic nurse practitioners can arrange for wellness checks for you. And on the weekends, the nurses in the healthcare center that are responding to those emergencies put that into place for you too. So that is that. So what can they do? They can check vital signs. They can help you with your medication, make sure you're taking it, get it for you, making sure, maybe helping you, like I said, heat up your soup, or going to pick up, meals for you or something like that. Help you with a little bit of, housekeeping or laundry around the house if you're just not up to that right now. Help you with your, they're not really your dog walkers, but they can be for a few days while you're trying to get over this. They can help you with showers in the morning if you're just feeling still a little unsteady and unsafe. And maybe just give you an idea what it's like to have private caregivers helping you out in the morning. And we do it for 2 weeks. The thought is if you need it for longer than that, then maybe you need to hire someone through one of the agencies to help you. Again, keep personal service providers. The ones that are non-agency, they have to fill out a packet with me. If they work more than 10 hours a week, I can get them a parking garage sticker for their car and a fob, so they can, start parking in there too. And I talked about all of that. Halcyon, again, is our preferred provider. They can provide private duty services, home health, and hospice. There are plenty of other agencies. If you prefer to go with someone else, I can give you recommendations for that. Again, private duty caregivers can help you with bathing, grooming, housekeeping, pet care, med management. Let's see. Okay, home health. Touched on this as well. This is when you need skilled services. So skilled services means someone with a license. If you need nursing care in your home and independent living, or physical therapy in your home, we can order home health for you. It's usually a 60-day period. They can continue after 60 days if you still have goals that you haven't met. You'll see things like wound care when you need a nurse in there. Some people, medical, really having trouble with their COPD and they're needing new oxygen orders and really need not just caregiver help, not just someone to help them, dress and bathe, but someone who, really need nursing care. So that is home health. We have had a few presentations on hospice, but hospice is the most amazing service. When the time is right, hospice just will give you so much comfort and support for people going through that period in their life. You can stay in independent living for as long as you want, as long as you're safe and supported, even if you're on hospice, and that is your wish. We talked about select rehab. PT is more, working on those larger muscles when you're walking, when you're balanced. OT usually works on smaller things when you're trying to, get back to working in the kitchen and figuring out how to shower yourself. And speech is more the cognition and memory, and a lot of times swallowing too, if you're feeling like maybe we're having trouble with aspiration. Therapy questions. These are just some cute, I think this is supposed to be later on, but just some commonly asked questions. If your physician gives you an order, a written order for physical therapy, what can I do with it? Can I use it to get therapy here at Select Rehab? Yes, you can. Just bring that order down to myself or Diane in the clinic. She'll do the insurance verification piece of it and get it over to therapy, and you'll get a call from them to get those services started. Next question, if I elect to use Select Rehab, what procedures do I follow? Kind of the same thing I think I just answered. We'll verify that insurance. That's a little starting point, and then we'll push it forward. Do you need to do anything else? No. Higher levels of care. So at Westminster, there's 4 levels of care. Independent living is where you're at right now. But then we have assisted living, we have memory support, and we have skilled nursing, the ARBOR. The skilled nursing, the ARBOR, is broken down into kind of 2 different units. Long-term care is the 2nd floor of the ARBOR. The 1st floor is rehab. So you'll see a lot of people come in from outside, coming in from Brookdale or coming straight from the hospital. It's rehab. They come, they go through our therapy services and discharge back out. The 2nd floor are long-term life care residents, mostly, that are up there. Assisted living is on the 1st and 3rd floor of the Carlisle, and then the 2nd floor is the memory support unit. So moving to a higher level of care, spend a lot of my time with having those conversations with people. When is it the right time? How do you go about that? And it's not a quick overnight process. It might start with just a conversation. We sit down with you, with your family. We talk about what that unit is like. You can take a tour anytime. The goal is really to keep residents in independent living as long as possible, right? I think that's everybody's goal. You want to stay there. And like I said earlier, as long as you're not in danger and you're safe, we're going to encourage you to do that. But if you're finding that it's time, or you just want to learn more about it, we'll sit down and we can talk about all of that. Definitely start the conversation. What are your goals? What are you concerned about? Maybe I just can't manage my medication. I forget to take my medication. Well, we have an answer for that. We could put medication management services and keep you in independent living and keep you independent a little bit longer. Let's see. So, we continue to have that conversation. I keep a interest list for people that are interested in possibly moving over to assisted living. I meet every Friday with the teams from assisted living, memory support, and healthcare. They let me know when a room is available over there. And that's when I go to my list, and it's, some of the people on that list have been on there, for quite a while, but maybe their names come to the top of the list and they're just not quite ready. So they stay on the list. And some people maybe bump up on the list a little bit because they're having some pretty rough, issues physically or challenged a little bit more. So, we try to make our best decisions possible about who we're going to offer those rooms to. Definitely, I would encourage a tour of over there. It's lovely over there. They've done a great job. They have wonderful activities, wonderful activity coordinators. The dining rooms are lovely. It's really nice over there. Just as I said, I do assessments on people before they move into independent living, before anybody would be able to move over to a different level of care, memory, or assisted, you would have to have an assessment as well. We want to make sure you're appropriate to be over there and that we can, that's the best place for you and we can support your needs over there. For example, if you can no longer feed yourself, let's say, you're not really appropriate for assisted living. It would be more of a healthcare center switch. So they're gonna, come over and do an assessment on you and really just kind of, how are you ambulating? Are you still able to transfer? Are you still able to feed yourself and groom yourself and bathe yourself? And it's not 24/7 care. They have, definitely are going to take over your medication management, and they have people that can assist you with bathing and that kind of thing. But it's not full-time one-on-one care, so we want to make sure that's the right fit for you guys. So let's talk a little bit about healthcare. So healthcare is not a hospital. If you are not stable medically, they're going to send you out to the hospital to stabilize. They're not going to, it's not like I need to go over there because I'm sick right now. If you're sick right now, in EMS, they're going to send you to the hospital, get stabilized. And when you're ready, then they can discharge to the healthcare center, go through the rehab, get you stronger, get you ready, set you up for success when you're coming back to independent living. Let's see. What are we looking for when we're talking about moving someone to a higher level of care? What are we seeing? What can you keep an eye out for when it comes to your neighbors? Are things like a lot of falls, frequent falls. Somebody who all of a sudden looks like they're poor hygiene, they're not able to take care of themselves or groom themselves like they normally do. Incontinence that they're not able to manage. They're losing weight, they're not eating like they should. Having trouble transferring. Also someone who's having behaviors, abusive behaviors, being rude or belligerent or mean to other staff or residents. And we also look for people who might be getting lost or wandering inside the building or outside the building. So those are all red flags when we start to have these conversations about, is it time maybe to consider some support in your apartment here, or maybe time to consider a move to a higher level of care. After our emergencies, we talked about that a little bit. Y'all have a physician, a primary care physician, hopefully, and they usually all have after-hour emergency call numbers, so call your physician. Make sure you have that number, make sure you post that number. If that doesn't work and you can't get what you need, pull your cord. We're here for you. They can administer that first aid. They can't do procedures. They can't write prescriptions, but we can certainly then call 911 and have EMS respond if we need to. You don't have to go out EMS. All right. Some questions. These are questions I get all the time, actually. Hey Traci, I'm scheduled for hip surgery tomorrow. Do I need to let you know? Yes, please, please. When do I let you know, Traci, when I'm having hip surgery? Like as soon as you know, that would be great. So it's on the list. What information do we discuss? So, if you come to me and say I'm having hip surgery, I'm going to have that conversation like, hey, it could look like this, or it could look like, how do you want it to look? Do you really have a strong desire to come back to independent living, or do you want to go to healthcare for a little bit? And we'll just get our plan together. If you're going to go out to have surgery, even an outpatient surgery, I'm going to ask you, do you have transportation? Oh, do I need? Yeah. If you're going to go out and have surgery that you're going to have anesthesia, we need to talk about that, because the security guard is not just going to pick you up after you have anesthesia. We need to have somebody with you, or you're going to be, there's going to be more conversation about that. And maybe you need well checks for a few days. Maybe you need our caregivers to help you get through that recovery. maybe you need some equipment. Maybe you need a walker just for a few days. We have a lovely loaner closet with so many walkers in it. Please, if you need a walker, let me know. They're all over the place in there. That we can loan you. People donate back to us all the time once they get through their recovery period, so we probably have something you could use. Hey Tracy, I'm really concerned about my neighbor. What do I do? Let me know. Just talk to me. I'll keep it confidential. I won't tell them where I heard this, but you know, I would want the same for my mother. I would want someone to say something because I'm not there all the time to see what's going on. Hey Tracy, another resident keeps asking me to help them. What do I do? And I know you don't want to be rude and y'all want to be helpful and you want to do the right thing, but let me know so that I can offer support so we can support them, because that can be rough on you. You've got a lot to take care of on your own. So, outpatient procedures, do I let you know? Yes. You know, I don't even care. You can let me know you're having a little mole removed. I'll just keep it tucked away. What services are provided? Transportation. So our transportation, you know, system will take your transportation system. Our department can take you to a doctor's appointment, pick you up from a doctor's appointment, and it can take you to a procedure. It's the anesthesia that's going to be the kicker there. I live alone with no children. Is it necessary for me to hire a halcyon or other vetted attendant? I think that depends on the situation. If you're going to need some help, you know, it might be a combination. We you know, have several people that do have caregivers, maybe in the morning and the evening, but in the afternoon we're just checking in, you know, with well checks in between. So let's just put together a plan that works for you and supports you. Pharmacy services, this is a question that comes up a lot. Pharmacy services, I think there's about 3 that deliver, definitely Terrytown. I think the HEB on Balcones delivers, but the weekends can be tricky. And there isn't anyone here that can go pick up prescriptions for you. So make sure if you're going to be running low on prescriptions, you get those things taken care of before the weekend comes up. Or have an Uber pick you up. Don't have Uber take you. Have a backup pharmacy that delivers if possible. Have friends or family that maybe can assist you get those things. We're doing pretty good on time. We have some other presentations coming up. There's another one that I will do in November with a lot of these what if questions. It's a whole presentation. What do I do if? What do I do if? What do I do if? The other level of care directors do a presentation similar to what I'm doing right now once a year. Joe is the director, Joe Sanchez is the director for assisted living and memory care, and his presentation is coming up October 14th. A lot of good information there about those units, so come and enjoy that. And then Cassie, who's our administrator for the healthcare center, the Arbor, she's doing her presentation in September on the 30th at 2 o'clock. Those levels of care also once or twice a year do open houses, which is a great, you know, way to just learn more about those different units and what they provide and the services. You can always go to those. And then our clinic does at least 2 presentations a year. They just did one, like I said, in May on just the wellness clinic itself and the services they provide. And then we're going to be doing the one on all the vaccinations, the COVID and the flu vaccinations and all of that in, there it is, 8/12. So come to those, enjoy those, and I think that is it. We're a few minutes early. But come see me, you guys. If I'm not there, call. I've got cards, I've got brochures, leave me a message. I'll come to your house, you can come to my house. I want to know what's going on. Any questions? Yes, sir.
I have noticed that as I become older, I have difficulty sometimes in swallowing.
Okay.
In the event someone becomes choking in the bistro, for example, what can be done? What should be
This is
done?
really interesting that you're saying that, because we are doing kind of an instructional class with the bistro staff here in the next, like, we're trying to get a fire department to come in. I don't want to train them all on CPR, but I do think at least one supervisor in each dining room at all times needs to know how to do the Heimlich. So, definitely what would happen is, you know, once we get those people comfortable, they can try to do that Heimlich, but they're gonna still pull the pull cord. You're gonna have the wellness aide and the nurse respond as quickly as they can possibly get there and try to get, you know, the situation taken care of. So, you know, just if you were at any restaurant, we need to be able to respond to that. Yes, ma'am?
Last year, the COVID vaccine that we received was not the latest one.
Mm-hmm.
Are you gonna be able to do that this
So-
year, or?
The COVID booster clinics are run by Tarrytown. I can't tell you off the top of my head what the vaccine is. I could get that answer for you. We've already started to organize it and get it ready. I don't know exactly. I know the flu, you know, you get the high dose, and we try to get the high dose so we can protect all this, you know, they recommend that for seniors. And I can try to get that answer for you. They probably know at this point. They're probably pre-ordering those vaccines at this point. We've already ordered our flu vaccine at this point. So I can try, but I don't know off the top of my head. Sorry. Yes, ma'am?
Are non-Westminster residents eligible to move directly into assisted living or memory care, or do all of them have to come from independent living?
No. They can come in. There's quite a wait list. And I would have to go through probably all of my independent living residents who are waiting for assisted living and be at the end of that before they would offer to an outside. It actually happened in the memory care unit once since I've been here, where a room came available. I had nobody on my list that was interested, no takers, and so they offered it to an outside that had been on that memory wait list. It's managed by marketing, just like the wait list is for independent living.
Is there usually a long wait list for those two services, for assisted living?
Internally, and yeah, the answer is yes for all of the above.
Okay.
Yeah, so I would, you know, especially assisted living, I think there tends to be, and a lot of it is just, you know, I know it's coming in the future, I'm not quite ready, people go on the list. You know, but sometimes, you know, especially memory decline can happen quickly, you know, but if you're interested and you want to talk to me about it, or, you know, think it's time that we maybe go on that, you know, interest list, let me know. Yes?
Would you provide the phone number for the health clinic? So,
For the clinic?
yeah,
Yeah, what's the direct line? Do you have that off the top of your head?
I didn't bring any cards and I don't remember it
Yeah.
off the top of my head.
Hang on. 512. And I've got here. I didn't bring the clinic brochures. What am I doing here? When I meet with new residents, when residents first move in, I let them get settled in for about a month, and then I go do a visit with them and talk to them about all of our services, and I give them a magnet for their refrigerator. Is that right? 382-4675?
Yes.
Okay. 512-382-4675. But swing by and grab a card next time you're by the clinic, or we can give you one of those magnets too. Unfortunately, some of the refrigerators in your apartments are not metal. Yeah, they're not sticking on some of the new ones. So, anything else?
Would you repeat the number?
Yeah. 512-382-4675. Yep, I'll get you right to the clinic, make an appointment, go see the ladies, they're wonderful.
I just haven't, said because of Debbie. Debbie has a form that it might be helpful to take the information that's in your refrigerator to fill this form out to give to your children. Just for those of us whose children go with us.
Oh, children, so that they have the information on the
information.
clinic number and all of this information.
Yeah, so Debbie can provide you the form.
I've got her on speed dial.
No, it's actually, it's a PDF file that you
Yeah.
type in, it's updatable, so it
Share that. Anybody else? Any questions? It's a lot of information. We do a lot of stuff up there.
We have AEDs all over the place. I wonder how many times they've been used and who uses them, and are the residents capable of using them?
Are they capable of using them? We don't train residents or show residents how to use them. We do have staff that are responsible. So we recently turned the AED rounds, checks, over to the security team. So they are now responsible. Diane used to do it herself. How many do we have? Oh my gosh.
18.
18 AEDs all over this campus. So, and we check them on a very regular, frequent basis to make sure the batteries are good, the supplies are there. But yeah, they're there if you need them in AED. I mean, they're kind of the kind that talk you through, open this up, place it on there, let me check. Oh, there's no heartbeat, hit this button. It kind of talks you through the kind you even see in the grocery store. But
Would
we
you
have
don't
them.
want residents to use it even if they could?
I would think it's something, no, I wouldn't expect a resident to do it at all. I would expect the healthcare center staff or EMS or someone in a role like myself to use those.
What we were told was to don't use it, you can get it there, but the only time you use it is if EMS is directing you to do it, because then they're responsible for it, not the resident. EMS assumes responsibility for talking you through it.
I mean, if someone doesn't have a shockable rhythm and you would shock them, and it would not be a good thing. So I would think someone who is very comfortable with using that piece of equipment should only be the people using it. That's my 2 cents. Yeah. But again, I mean, you see them everywhere, right? Most places you go now, they have these AEDs, and they are very user friendly. But we'll get there as fast, pull the full cord, we'll get there in a matter of minutes, and let us take responsibility for that, would be my advice. Yes, ma'am?
Do you have a handout list of the programs that are coming up and what those are? You went through it real fast, but couldn't get going that fast.
I don't have a handout, but I can certainly print some out and put it, in my office if the different presentations.
Right,
Yeah.
so that we can
Yeah,
get it on
it's
the
definitely
calendar
rolled
and-
into Ruth's, calendars and things like that.
Yeah.
So, yeah, definitely would love you guys to come to all this.